Hello, Hainan with Nanaimo Hearing Clinic and today's hearing soundbite. Did you know that there are not very many ear emergencies? Most hearing loss is gradual, and most ear conditions are not an emergency, so to speak. There may be medical conditions that your physician needs to address and possibly needs to address quickly, but most of them are not what we would consider emergencies. However, there is one, and that's what I want to talk about today. And it's something called sudden hearing loss. The even more technical term is sudden sensorineural hearing loss. Here's what it is. It's when you wake up, or it doesn't have to be waking up, it could just be any time throughout the day. Very quickly your hearing changes, sometimes suddenly, sometimes within a matter of hours. It'll change. You could go completely deaf. You could lose a certain percentage of your hearing, but usually a fairly significant, so that you really notice it. It could be accompanied with a bunch of extra ringings, sometimes called tinnitus, or some other sounds and sensations. But oftentimes it's just that one particular, sometimes both, but usually oftentimes just one ear will go really dull or dead seemingly. If this happens, this is an emergency. And the reason being is the sooner you can get medical treatment, the sooner it's possible that it might be able to be reversed. There's a fairly short time frame, sometimes as little as a few days or even less, where if you can get that medical treatment, usually from an ear, nose, and throat physician, a specialist, then there's a chance that that can be reversed or partially reversed. So what to do if somebody you know says, my hearing just changed all of a sudden? Number one, get a hearing test immediately. And number two, see your doctor immediately, like that day, or go to emergency right after you get a hearing test. The sooner you do it, the better chances that you have of hopefully getting some treatment for that. So most hearing loss is something to definitely address because it impacts your life. There definitely could be medical conditions behind it that you want to know about. But if you ever have sudden hearing loss, make sure you get a hearing test and see your doctor right away. And ask, depending on the results of the hearing test, ask to see a ear, nose, and throat specialist. Have a good day.